Welcome to our session today, highlights from the Quality Compendium, State Quality Improvement System Revisions and Equity Approaches. I'm Debbie Mathias from the BUILD Initiative and the Director of the Early Childhood Education Quality Improvement Systems Network. We're very excited to share the new data and state work with you today and welcome continuing feedback and ideas about the Quality Compendium. We hope these sessions enable us to illuminate challenges, innovation, and promising practices. We're interested in your questions, ideas, and thoughts throughout the session, so please enter into the chat box as something strikes you. If you have a resource or strategy to contribute from your work, please share. We'll answer some questions as we go during the session and have a Q&A opportunity at the end after the presentations. But we'll also post a question and answer document with the session after the webinar on the BUILD website. Now for the agenda. First, our team from Child Trends will share some information about changes that were implemented in the compendium during our fall data collection and information about the compendium and how to use it in general. Then we'll hear from two states about their data. Michigan about changes to their quality improvement system, and Idaho about how they represented their equity approach through the compendium data. Finally, we have some evaluation questions we encourage you to complete. It's our own CQI to improve the experience for our participants, and we welcome your feedback and ideas. We have a great panel today. First, there's me, Deb Mathias, and then Phoebe Harris and Holly Keaton from Child Trends, Kristin Opsimer from Michigan, Malia Wisner, and Chelsea Crema from the Idaho Project. You know, I don't want to take up any more time. We have so much to cover today. So I'd like to hand it over to Phoebe and Holly to share some of the basics.
Thanks, Debbie. First, I just want to extend a huge thank you to our state leaders who are joining us today, and also to BUILD for hosting this webinar for us. So the Quality Compendium is a database of 45 quality improvement systems and initiatives, most of which are quality rating and improvement systems. For context, you'll hear us use the term QIS, or Quality Improvement System, throughout this presentation. And that's just to be a little bit more inclusive of the ranges of initiatives that are happening across the country. So to give you some background on the compendium, the first compendium was prepared as a report for the Federal Office of Planning, Research, and Evaluation in 2010. A few years later, we turned that report into an online database, which is updated every other year. So the fall of 2021 was our most recent data update. So because this field has emerged over the last 20 years, the primary purpose of the compendium is really to serve as a resource that has up-to-date information and help us learn from other states about how we're approaching quality across the country. The compendium captures shifts in the field over the time, and it really helps administrators identify promising practices in other systems that might inform changes to their system. So now I'm going to turn it over to Holly, who's going to talk about our data collection process and the information that's currently available on the compendium.
Great, thank you, Phoebe. So as Phoebe mentioned, we have a biannual data collection process. And in this process, the first step is that state, territory, and local QIS administrators fill out an online profile that captures information about their QIS. Once completed, Child Trends staff review these profiles for consistency, and we send back any questions or clarifications to administrators. As a new process this year, Child Trends met with state administrators to clarify data questions and to learn about efforts to support equity. So Child Trends conducted interviews with 36 states and used these interviews as an opportunity to clarify confusing data elements and ensure that all data elements were filled in. Additionally, interviewers asked administrators questions that extended beyond the information captured in the compendium, so asking more about equity, planned revisions, and the revision process. And after these interviews were completed and the data were finalized, Child Trends released the data on the compendium website in January of 2022. So now I'll kind of go into some of the information available on the Quality Compendium website. And one of the most useful features is the View State Profiles page. So on this page, you can learn about individual states' QISs. So you can select the state to see an overview of their system and then click on the View Full State Profile to see a more comprehensive report of that state's QIS. So here's the information you can find if you click into a state's QIS profile. State administrators report information in each of the tabs during data collection. So as you can see, we collect information about QIS's participation, rating system, financial incentives, technical assistance, and more. Another useful function on the website is create a report, which you can use if you would like to download data about QISs. So you can select the states or localities that you're interested in. And you can also select the data elements that you would like to analyze. And then you can download a CSV data file with that information. You can choose to download information from all states and localities and/or all data elements from all categories. However, if you're interested in viewing all of the QIS data in the compendium, we would recommend that you download the cleaned master data set. You can find this in the About the Data section, along with the master data sets from previous data collection cycles. This section also has information about our data collection process, fact sheets about the compendium, the suggested citation, and the glossary of terms used on the compendium website. Finally, each data collection cycle, the compendium reports on the top trends in the data. So for example, you can see what features of assessment indicators states are using in their QIS. And you can click through the tabs on the left to view other trends in the data, such as density or professional development indicators, and so forth. This data collection cycle, we piloted several new data elements in reaction to the trends that we were seeing in the field. So on this slide, you can see a few highlights from that update. We asked states about recruitment and engagement with providers, including which populations are targeted and the recruitment strategy used, information about upcoming revisions, information about other quality initiatives operating within the same geographic area, but outside of the quality improvement system, racial equity approaches to recruitment, participation, quality improvement, rating, and any other approaches, and eligibility to receive and accessibility to financial incentives and technical assistance. So now I'll hand it back over to Phoebe, who is going to go into more depth about some trends in the data this year.
Thanks, Holly. Okay, so to give you a brief glimpse into some of the data that's available on the compendium, I'm just going to walk through a few trends that we saw in the 2021 data. So this trend highlights one of our new data elements that Holly just went over, targeted recruitment for programs. So 22 quality improvement systems have targeted recruitment strategies in place. The most commonly targeted program type was those serving children receiving subsidy, followed by programs located in high poverty or high need areas. The other program type category at the bottom of this chart included themes such as targeting programs participating at levels 1 and 2 of the system, targeting programs who are speaking languages other than English, and programs serving children with special needs. So this trend covers quality improvement system participation between 2019 and 2021 using participation density. So by participation density, we mean the number of rated programs who are participating out of the universe of possible programs that could participate. So as you can see, about half of systems saw an increase in participation density, about a quarter saw a decline, and then the remainder saw no change. Most of the systems who had no change in density rates have some sort of mandatory participation rule in place, meaning that all of the potential participating programs are participating because they're required to do so. So as I mentioned earlier, one of the core purposes of the compendium is to capture how systems are changing over time. So this trend summarizes information both from the compendium and also the interviews that we conducted with administrators. And it provides some information about where systems are in the revisions process. So just to note that we did include interview data for this trend because a handful of states weren't ready to publish this information publicly on the compendium, but still had plans or ideas in place that we wanted to share. So in this chart, you can see that most systems have some sort of plan for revisions or are implementing them in 2022 or soon after. A handful are currently in the planning phase. So that means that they're engaging with constituents to solicit feedback or engaging in some other sort of planning process. And then a few are implementing completely new systems. Okay, so this slide covers another new data element that we added in 2021. It's about quality initiatives that are happening outside of or in tandem with the quality improvement system itself. So while this data element likely doesn't reflect a comprehensive list of initiatives, it does give us a sense of the breadth of quality work that's going on across the country. The initiatives that administrators wrote about in this field tended to be longstanding programs set up in states that are available to providers regardless of their participation in the quality improvement system. So you can see that these initiatives covered a variety of topics. A good portion of them had selected other as the primary focus. And in our review of the descriptions of these initiatives, administrators talked about focusing on topics such as infants and toddlers, supporting children with special needs, providing substitute pools, and other mechanisms to support the early care and education workforce. Okay, so in a moment, you're going to hear directly from our state leaders who have joined us today. But if you have any questions about the compendium or the data that we presented, please continue to send messages in the chat and we'll get back to you. We do plan to post some written responses after the webinar, as Debbie mentioned. So yeah, keep the questions coming.
All right, Phoebe and Holly, thank you so much for that introduction to the basics of the quality compendium. I have a couple of questions that folks are sending in. Are you planning to revise the fact sheets that are in the resource section of the compendium?
Yeah, so after every data collection cycle, we do select a few fact sheets to update. So we have a few in the works right now, so keep an eye out for those coming out over the next few months.
Oh, great, great. Hey, how did you get the data? Is the data from like mostly state responses to it's time to update, right? But you also used other sources of evidence to understand the state work too, right?
So it's mostly information that we get straight from administrators. So as Holly mentioned, they directly go into their online portal, they enter information. And then this year we also had conversations with most of those administrators just to make sure we were capturing the right information and that we had some consistency across states.
Mm-hmm. And I know that you have a place in here where there are links to areas of the state websites or more detail about information manuals and other sources of information. Like I think there was a link to competencies or other types of data or information from the state. And that's really becoming more and more invaluable, I know, to state leaders. I want an example, a real specific example. So we super appreciate the state leaders sharing their data and the contributions they make, taking some time to really update this. So they're definitely the reason this is working so well. You know, we have metrics about the quality compendium, and gosh, over 800 people a month get into this data source and pull data reports to inform their thinking and innovation. Well, thank you both so much for sharing the information today. And now we'll move on to a state example. Christy? Let's hear about what Michigan's up to.
Thanks so much, Debbie. Appreciate it. Hi, everyone. I'm Kristin Opsimer. I'm the Director of Systems at the Early Childhood Investment Corporation, and we implement Great Start to Quality, which is Michigan's quality rating and improvement system. I'll talk a little bit today about sort of where we are in our rating system and the revisions that we're making, and how we use the Compendium data to get there. So just a little bit of background. Great Start to Quality started way back in 2011. We had some minor revisions in 2014. And so here in 2022, we know it's time to take a closer look. So currently our system includes all licensed childcare programs in Michigan, including preschool and out of school time programs. It is a voluntary system, not required, but anyone can choose to participate. We are led by our Department of Education in Michigan. And again, it's implemented by the Early Childhood Investment Corporation. So this is our current process. And you'll see it is a little bit of a cycle here. And programs can complete an application process and then a self-assessment survey with our quality indicators. Right now, our quality indicators are scored, points are awarded, and so it feels a little bit high stakes. And those points help us to calculate the rating. Currently, we have a 5-star rating system, and I'll talk a little bit about that as we move into revisions. Once they complete that self-assessment survey, they have an opportunity to do some quality improvement planning. And then we have a validation process for many of the folks that go through this. And then they can move on to on-site assessment, as long as those scores in that self-assessment survey are high enough. So there really is a progression there. And then they have a published rating. So in order to support providers going through the process, we do have 10 Great Start to Quality resource centers across our state. They provide professional development, support our license exempt providers as well, which is another arm of our Great Start to Quality system. They have access to quality improvement consultations, so to really help them move into the next level. Certainly technical assistance to just get into the system and learn about the indicators and sort of where their quality is currently. And then access to quality improvement resources. So things like lending libraries with curriculum, tools that they can use in their classrooms, libraries of resources, et cetera. So one of the things that we know to be true as related to inequities in our system is access to particular tools like curriculum and assessment. We're thinking about the languages in which we support providers and families to use our system. Access to technology is certainly a barrier for a lot of folks. I think any state that has rural parts and pieces runs into this, particularly in our Upper Peninsula, where internet access is spotty. That is a real challenge. It's high stakes scoring. As I talked about, these points matter in our current system, and our rating system is also connected to childcare subsidy and tiered reimbursement. And so if they don't have access to that curriculum and they lose those points, they can't move to the next level. So we're seeing that as a real barrier for a lot of folks. And certainly engagement in marginalized communities. We're just not getting our hands on folks like we'd like to, just because of many other barriers as well. So revisions, they all started for us in 2018 when Michigan completed the validation study with the Race to the Top Early Learning Challenge funds. And from there, we took the findings from that validation study and created an advisory committee. And they are continuing to do the work of revisions till today. In 2020, despite COVID and all of the things, we were able to conduct focus groups, interviews, and surveys to continue to collect more information. What isn't here is in 2021, we also conducted a pilot with many of the providers in our state related to revised indicators, so we could get their continued feedback. And then also on utilizing CLASS. So in Michigan, we're the only state currently that uses the program quality assessment, and know that shifting to CLASS is a little bit more equitable. So that's something that we're looking to in the future as well. And certainly all of the ongoing provider feedback that we've received since the inception way back in 2011. So this is just another look at our timeline, sort of where we've been, and we're getting close. So we're planning to implement this fall, and we still have a lot to do, and we'll talk about what that looks like. But that this is how far we've come in sort of all of the parts and pieces along the way. So this slide just gives you a little bit of a flavor for some of the things that are the same and some of the things that are different. And certainly this is a helpful image for the childcare providers in Michigan to understand the things that I can hold on to that are currently true and the things I need to pay attention to that are changing. Certainly our focus is shifting from rating to quality improvement. I saw a lot of comments in the chat about the acronym, and I'll talk a little bit about that in a minute. But I think the most important thing for us in Michigan are those three bullets at the very end on the right side, really thinking about quality improvement planning, aligning with and including various program philosophies, and really focusing all of the decisions that we make with an equity lens. So this is what our new revised system is going to look like. And so moving away from ratings, again, we have 5 stars currently, and we really wanted to move away from that piece. And so we're really using words to describe where programs are in the process. And so you'll see that at the bottom, there's health and safety, and that just means they're licensed. They're maintaining health and safety regulations. And then once they move into sort of the process, they can reflect on quality, right? And so they're still looking at quality indicators and taking a look and seeing how their program fares based on those high quality indicators. And then they move into this enhancing quality space where they begin to create their goals. And so they can choose to enlist the services of someone from our resource centers, or they can move through that process on their own. But certainly lots of coaching happening in that space. And then once they're ready, and that can take as long as they'd like, they can move into demonstrating quality. And that's where we would conduct those class observations. And they would need to meet a threshold score there to publish at that demonstrating quality. So you'll see it's a continuous cycle, similar to what we're doing now, but sort of taking that high stakes restrictions out of what we're currently doing. So here are some of the language changes, and so this sort of reflects back to thinking about, how to be more inclusive. We are changing from a quality rating improvement system to a quality recognition and improvement system, since we'll be taking the rating piece out. We're moving from things like called action items to goals, self-assessment survey to self-reflection, stars to levels, rating to quality levels, and just really trying to use more supportive language, on-site assessment to observation, and consultant to coach. So where does the compendium come in for Michigan? Well, it's come in for us all along the way. Certainly through the work with the advisory committee, we were pulling data to see what other states used for their observation tools, what kinds of indicators they were using, what made sense for Michigan, the types of language they were using, what categories we might bucket those indicators in. And then once we got to a space where we were feeling comfortable with the indicators, we had to put our data into the compendium and to be able to answer some of those questions. And so it really allowed us to reflect on, oh yeah, we're meeting these things and we have an answer to put into the compendium, or no, we don't. And so we really need to think about these things. And so how are we addressing these inequities? So we are changing that on-site observation tool. We're addressing language and reading levels of those indicators. So really sort of paring it down and making it really clear language. Providing translation and interpretation throughout the process. And that's something that we're currently implementing and we'll continue to think about as we move into how we're communicating these revisions to providers and families. We're working to translate the interface, the actual technology system in which providers interact and work on that quality improvement piece, and really trying to simplify that process in and of itself. So by virtue of making it less high stakes, there's fewer buttons to push inside of the process. So how are we preparing for the change? So communication began a year ago, just to let providers know that it's coming, and change is hard, we know that, and so we want them to be prepared. You'll notice our logo has the 5 stars in it, so we're going to have to do a complete rebranding since we're not doing the rating anymore, which is exciting and will help us sort of reimagine what Great Start to Quality looks like for providers and families. Again, we're working on those technology changes currently and working to get input and buy-in from our Great Start to Quality staff. they're in the field, they're working with providers, and so really getting their feedback and in collaboration, making some of the decisions so that they can feel comfortable supporting childcare providers. And then lots and lots of training and webinars and communication so that everyone feels prepared and confident with the changes that are being made. So some things that we're continuing to think about and using the compendium to do that. Certainly the connection to subsidy dollars. So now that we have fewer levels, if you will, we'll have to think about how that tiered reimbursement is going to look. Additional tools that might support quality improvement. We know many states are sort of shifting to the notion of badging or focus areas with all of the great assessment tools that are out there. So we're thinking about that. And certainly gathering more feedback as we go and share parts and pieces like the indicators with providers, thinking about language tweaks that we can make. And so certainly I use these opportunities to connect with all of you from other states and learn from you. Here's some contact information, and I would welcome any of you to reach out and ask further questions.
Thank you so much, Christy. We do have a couple of questions in the chat box for you. How did your revision process take into account the needs of different types of providers, like family, childcare? And we also had a question earlier about how supporting license exempt providers. So just talk a little bit about your thinking about the different types.
Sure. So as far as bringing in all childcare provider types, so that was a big piece of feedback that we received from family childcare providers in Michigan, was that our rating system didn't meet their needs and they didn't feel included. And so a lot of what we did was we chose class because we wanted to make sure that we had a tool that was supportive of them and interactions, which we know are very rich in child and family childcare providers in Michigan. And a lot of the language, we took out a lot of the center-based or center-focused indicators and really tried to choose quality indicators that met everyone's needs. We had many family childcare providers on our advisory committee that helped us think through that to say, you're on the right track, or maybe you're not. So really try to include everyone.
Thank you.
Yeah, go ahead.
I was just going to say, but finish your thought first.
Yeah, I was going to move to license exempt, but if you want me to address that, I can.
Yes, please say a little bit about that.
Yeah, sure. So in Michigan, we have a group of providers that are license exempt. Some states call them family, friend, and neighbor, and they are part of the continuum with Great Start to Quality, although they do not get rated. So we do have supports around improving their quality. And some of them move into a licensed space and then come right into Great Start to Quality as well.
So in your system, you still have standards which kind of light the pathway of best practice and where we're headed, right?
Absolutely.
And you still do have acknowledgement of different levels for parents to be able to ascertain this program is recognized as quality by the state system. So in a way, there is still a rating, but the focus is on the improvement, right?
Absolutely.
Okay, so I see what you mean. Let me see, I think I have, and for programs that are in that enhancing quality phase, they're working on quality plans, they're thinking about it, but really I like the way you showed it as a circle. It's a continuing, even if you're a recognized as quality program, you're still in the process of using your data and sources of evidence to inform, is it an annual continuous improvement plan?
So programs can come through the process as often as they'd like. It would expire every 2 years, so that
I see.
If they decided to wait that long, that's fine. And if they chose to continue moving through earlier, that's fine too.
Okay. I think that's it for the questions from the chat box right now. And thank you so much for sharing. And let's move on to Idaho's ideas and what they're thinking about.
Thank you so much, Debbie.
Thanks, Malia and Chelsea.
Yeah, and to Build and Caltrans for inviting us. My name is Malia Wisner. I'm Idaho AYC Leadership Director for the Idaho Stars Project. And I'm joined by my colleague, Chelsea Crema, who's the Idaho AYC Equity Coordinator for the Idaho Stars Project. what I'm going to start with is just a general overview of the Steps to Quality system, the QIS in Idaho. The bulk of who you will hear from today, though, is my colleague Chelsea, as we dive a little bit deeper into the ways in which Steps to Quality integrates our equity work into our system. So just to get everybody grounded on the general concept that we have for our state's QIS, we are a voluntary 6-step block system. We do require license and subsidy compliance for a program to be rated in our system. There are some subsidy exceptions. We have about a 23% saturation rate. So as was mentioned earlier, that's that rate that looks at the number of programs who are rated compared to the global number of programs who are eligible to be rated in our state. We are an annual CQI cycle. So on the right there, you can see kind of the main elements of our annual cycle. For most of the year, programs are engaged in coaching and quality improvement. Within that relationship are lots of little coaching CQI cycles. So lots of continuous quality improvement happening within programs throughout the year. But once a year, we do have them have an ERS program assessment. Once a year, we do have them have a step verification. And then once a year, they receive a rating and recognition. One real large CQI cycle using the data from the ERS and the step verification to feed into the program's quality improvement goals, but also lots of little CQI cycles as they continuously engage in coaching. The breakdown of our 6 steps. Step 1 is very basic. It's an annual review that our office conducts within our state's database. It does not require a program assessment or verification with a verifier. It's not until a program can receive a step 2 through 5 rating that our system does require that they have those activities. So they have an official ERS assessment and a verification review with a verifier. And then our step 6 is just a fast track. It's for accredited programs and early Head Start and Head Start programs. So once they're able to demonstrate to us that they've received those accreditations, then we fast track them to the step 6 rating. And all of this work is supported by 7 regional childcare resource centers that provide coaching in business, health and safety, and general quality improvement in the field, in the programs. So you had heard earlier during the information about the compendium that there were some new data elements in this year's data. And so the racial equity approach is a new body of data that's available if you were to look at different states' profiles in the compendium. And what we're going to do today is give you a little bit of a deeper dive into that data element and the Steps to Quality program. So the data element is broken down into 4 categories: recruitment, participation, quality improvement, and rating. And we've added data to it as sort of a general category because you kind of can't get to the rest of those categories without looking at your data. Idaho Stars in general is committed to equity across all branches of our project. Our QRIS is just one part of the Idaho Stars project, but we are working towards an equitable approach to providing all of the parts of our project. And I'm very lucky to have a team member, Chelsea Crema, who is the equity coordinator for our project. And I'm gonna have you advance to the next slide and let her introduce herself and the ways in which Steps to Quality presents its equity information.
Thank you so much, Malia. So we're going to jump right in. And as Malia identified, in the racial equity approach, we're going to be looking at some of those different data elements that were identified this year by the compendium, but helped Idaho Stars really review and identify the ways in which our equity work, or the actualization of our equity commitment, has really demonstrated itself in the work that we're doing in our Steps to Quality system. So our first slide is about data. And as Malia identified, this is not one of the data elements that was included in the racial equity approach, but for Idaho STARS, we can't talk about equity without talking about data. So Steps to Quality, our QIS, uses an online database to collect provider data. And we were really intentional when we built that system to collect data, not only around demographic indicators like race and ethnicity, but specifically around language fluency, preferred training language, and preferred business contact language. As we have been really striving to increase our linguistic accessibility, we realized that data was key in being able to provide those supports. If we don't know provider preferences on language, we can't work to meet those. So we use this data regularly to evaluate the provider groups that are benefiting from our system and those who are not benefiting from our system. And that really helps us come to the table, and it helps us have conversations around equity in a way that feel actionable, right? When we can look at our data, and we have looked at our data, one of the things that we were able to identify in 2021 was that we had a real significant lack of involvement from our home-based providers. And that helped us have some really significant conversations about the barriers inherent in our system for home-based providers. And so this data then helps us target our interventions. What are we going to do once we have this information? So not only did we know that our system didn't it had a really high percentage of participation from center-based care and a really low rate of participation from home-based care. But additionally, we were able to look at the racial and ethnic makeup of our facility administrators and see that there was a much higher percentage of marginalized races and ethnicities as facility administrators for our home-based programs. So we knew that as we were missing the mark on including them in our QRIS, we also needed to address that from an equity perspective. So one of the strategies that we began with was really targeted recruitment. So Idaho has 2 cities, Boise and Twin Falls, that are refugee resettlement cities. And Boise specifically has a significant population of childcare providers who have come to the United States through refugee resettlement, who now own and run family-based childcare. So when we looked at our data, we were able to identify that was a population who was not benefiting from our system. And we developed strategies and targeted recruitment aimed at integrating these new American providers into our Steps to Quality system. We really focused on building relationships and trust with our coaches to help bridge the transition for these providers into our system. All right, so the next data element that we were looking at was participation. As we identified in our data who was benefiting and who wasn't benefiting, we realized that in order to help identify the barriers, we needed to talk to providers who were and were not benefiting from our system. So we reached out and included the home-based providers who were participating in our system, along with some new recruits who had recently been integrated into our system through the targeted recruitment. And we conducted individual interviews with these home-based providers to start asking questions about the questions we should ask, right? So instead of going to providers and saying, we're really interested in improving our system, how would we do that? We said, we're interested in improving our system, who should we talk to? Right? What questions should we ask them? So we really, from the beginning, we plan to be as intentional as possible about allowing this to be a power sharing and a co-creation opportunity. So we are still involved in these feedback loops. We've done not only the initial interviews, but we've done statewide surveys. And we're now in a stage where we just completed some co-interpretation of the data with this group of home-based providers, and we're excited to continue these cycles. All right, our next data element is equity and quality improvement. So we have a series of quality domains that are part of our system, one of which has been inclusion and diversity. But when we looked at the subcategories that were part of that domain, we saw that they really supported the inclusion side of the domain, and that the diversity was not there. We had access, participation, and supports. And so those subcategories primarily spoke to how a program was supporting inclusion. So we created a new quality subcategory specifically focused on diversity. You can read here, that bullet point is the language that we used. We also began a coaching and equity group for our quality consultants to start examining the application of the Pyramids Model's equity coaching guide, because we realized that we were talking about equity and data at a systems level, but we wanted to make sure that we were connecting that down to our staff who are interacting with providers, and eventually making sure that that was work that became part of the way that we were coaching and supporting childcare providers. Finally, we identified a real barrier in our system for some of our technology grants. At the time, they were reimbursement based, and we were able to see through some of our data that for providers who were most in need of technology, reimbursement was a real barrier to be able to access that technology. So we secured a vendor account with an office supply store, and we were able to pre-purchase the technology hardware for the programs who were participating in step 1 so that they could have access to those supports. All right, and finally, we have equity and rating. So as I mentioned in the beginning, linguistic accessibility has been something that's very important for us. We have lots of linguistic diversity in Idaho among our childcare professionals, as well as children who they're supporting. So as we began to build in the supports that are easily identified, being able to have access to translated materials or documents and being able to have an interpreter in your language when requested, we also realized that we were relying on personal relationships to help us identify language preference, as opposed to building that into our system where it was a direct ask of the childcare provider as opposed to an ask of the coach based on the preferences of the childcare provider. So we built language questions into our program assessment and verification applications, which now allows our system to assign an interpreter or request translation support when a program enters into the phases of verification and assessment. All right, so those are all of our data elements. And all of this work has really been part of a larger effort, which is where is our system or steps to quality going? So I'm going to hand it back to Malia so that she can give you a broader perspective of how these strategies have been part of an effort to improve our quality rating and to improve our quality rating and improvement system. Back to you, Malia.
Thanks, Chelsea. So just to wrap up, as Chelsea's saying, we really do aspire to have an improved system. We really want the performance of steps to quality to be accessible. We want it to be responsive. We want it to improve the practice, the quality practices of early care and education providers in Idaho. And we want it to be a positive experience for all childcare providers in Idaho. We were lucky enough in October of 2020 to receive a validation study from Child Trends, and we have since then been using the recommendations and information from that study to conduct a weekly internal validation study work group where we're really assessing the quality of our system against the recommendations from the validation study and the some of the data elements that Chelsea was just describing. We're very interested in incorporating beneficiary voice activities into this work. So the interviews, the surveys, the co-interpretation of data that Chelsea referred to, this is all really in an effort to utilize the expertise of those individuals who are using our quality rating and improvement system. So we want to work together with them to co-create the improvements to our system. So we at this point, we are engaged and we are excited, but it's not something that I'm able at this point in time to say, and these are our next steps. And that's partly because of our commitment to this beneficiary voice activity quality to any changes or improvements that we make to our system. There's nothing that is predetermined in our outcomes at this point, because it's all really based on that intentional relationship-based work with the users of our system, with the providers in Idaho. So we're working alongside them. And I look forward to some point in the future being able to give more information on the outcomes of that. But at this point, we're really just doing a deep examination of our system. We're very excited to use the updated information in the compendium to support the work that we're doing. And hopefully this gives you a little insight into what's happening in Idaho right now. So I think, Debbie, I'm going to pass it back to you at this point.
Yes, I'm typing away trying to answer a question. There are links to validation studies in the compendium too, where states have provided them. So, and I saw somebody in the chat box asking for those. Well, that was just such an informative presentation. And I think that you really rang true with the themes that we're hearing across the states, such as strength-based, providers as partner, as an engaged in revisions and implementation, with feedback loops for improvement, and not only at the implementing partner level, but at the state level in terms of policies and practices. So kind of at each level of the system, how are we thinking about improvement? A lot of the things that both Malia and Chelsea, you said about taking each provider where they are, respecting their ideas and thoughts as part of the process, and giving them some space to really be part of the contribution to the movement forward, progressing toward improvement. I loved what you said about how's the system working for all providers, children and family. And of course, that's a huge question that many states are looking at and rethinking as they go into a revision point of view. I think this notion of creating a more reflective and improvement-oriented system as a whole is really resonating for states and providers. You think this data was collected at the end of almost the end of the pandemic too, so states there's a lot of optimism and still focus on quality improvement from the states we interviewed and spoke with. And so I'd like to thank you for really all of your comments about how you really surfaced your equity approach in your work in the compendium, and sharing that information with us was really terrific. Did you have any connection, or I've seen this question a couple of times about family, friend, and neighbor associations? Your system is mostly for regulated providers, right? Can you talk just a little bit about how you're seeing that or thinking about that?
Yeah, that's correct. So in terms of our steps to quality system, so our QIS, licensing is required. Our larger Idaho STARS project, which supports all of the licensing and subsidy requirements, as well as professional development and our QRIS system, is made up of lots of different systems and different modes of support for providers at whatever level they are. So a license exempt or a family, friend, and neighbor provider might still be connecting with the resource specialist at their local R&R in order to get support for subsidy compliance, or might be getting business practice coaching. They might at some point move towards licensing, much like Christy had said in Michigan, which would then make them eligible for steps to quality. But while our QRIS system is limited to licensed programs, the supports that Idaho STARS provides in general is not limited.
I hear what you're saying, and I'm really seeing states think about this family, friend, and neighbor continuum of care, that's often the most appropriate for families' schedules, cultural, needs and wants. And one of the strategies I see states using is as they develop strategies for families as well, they're encouraging families to share that with their family, friend, or neighbor provider, So you might have a developmental discussion, handout or something for families to use, and then say share this with your caregiver or provider. So coming in the door, because often the biggest thing about FFN providers is there's no way they're identified to the system. We don't have their names or emails or contact information, and that makes it more of a challenge. So going through the parent door to their family, share this information with your caregiver or provider can be one conduit to get to that group of folks. But thank you so much. I'd like to thank all of you for your contributions to us thinking through the compendium data and the use of that data within states. And your specific state examples really help us understand more the usefulness of the data and the resource and how states are looking to it. So thank you so much for sharing today. Really appreciate Christy, Chelsea, Malia, and to our child trend friends as well, your contributions. And by the way, really, if you send questions about how to work with the data or how to, pull reports or anything like that, the Child Trends staff is very helpful to getting, better use out of the data for yourself. So, well, thank you again, everybody. And it's been a terrific way to spend an hour today. Thank you. Goodbye.